What diagnosis procedures are commonly performed for bladder problems? When it comes to bladder problems, diagnosing the issue accurately is essential for effective treatment. Healthcare providers have several procedures at their disposal to identify the underlying cause. Let's explore these common diagnostic procedures together. First, a healthcare provider usually begins with a physical examination. During this exam, they check for any abnormalities in the pelvic area. They may also look for signs of pain or discomfort when touching the area. Next, understanding a patient's medical history is crucial. The provider will ask about current symptoms, any previous surgeries, and medications that might affect bladder function. This information helps paint a clearer picture of the patient's health. One of the most common tests is urinalysis. This procedure analyzes urine for signs of infection, blood, or other irregularities that could indicate bladder issues. It is a simple yet effective way to gather important information. Imaging tests are also vital in diagnosing bladder problems. An ultrasound is a non-invasive test that uses sound waves to create images of the bladder and kidneys. This test can reveal issues like bladder stones or tumors and assess bladder size. Another imaging option is the quart urogram. This test involves a series of X-rays taken after a contrast dye is injected into the body. It provides detailed images of the urinary tract and can help identify blockages or tumors. Magnetic resonance imaging, or MRI, is another advanced imaging technique. It uses radio waves and a strong magnetic field to create detailed images of the bladder and surrounding tissues. This method is particularly useful for visualizing soft tissue. Specialized tests are also performed to get more specific information. Urodynamics tests assess how well the bladder and urethra are storing and releasing urine. They can help diagnose conditions like bladder outlet obstruction or overactive bladder. Cystoscopy is another important procedure. In this test, a flexible or rigid scope is inserted through the urethra to visually inspect the inside of the bladder. This can help identify tumors, stones, or other abnormalities. Lastly, the post-void residual test measures the amount of urine left in the bladder after urination. This test can indicate if the bladder is not emptying properly, which is crucial information for diagnosis. Understanding these diagnostic procedures is key to maintaining bladder health. If someone experiences symptoms like difficulty starting urination or frequent urination with small amounts, these tests can help determine the cause. Early detection of bladder issues, including potential cancerous changes, significantly improves treatment outcomes. Therefore, seeking medical advice if symptoms persist or worsen is essential.